This brief learning module, When to Test, will teach you when it is appropriate to test residents for COVID-19. Before testing residents for COVID-19, it is important to know what signs and symptoms to look for. Signs are changes that you observe. Symptoms are changes that the resident tells you about. The most common signs and symptoms of COVID-19 include a loss of sense of smell or taste, cough, fever, muscle aches, diarrhea, fatigue, shortness of breath, and a sore throat. Signs and symptoms usually show up 2 to 6 days after exposure, but it can take up to 14 days for a resident to start showing signs that they are sick. A resident with any of these signs or symptoms of COVID-19, no matter how mild, should be tested. Symptoms can show up in people who have not been vaccinated, as well as in those who are up to date on their vaccinations. People might also have COVID-19 without showing any symptoms at all. This is why your nursing home may ask staff members to be tested for COVID-19 based on facility and federal government guidance. So keep in mind that even if you are vaccinated and not feeling sick, you may be tested. A COVID-19 test is for a current infection. The most common test used in nursing homes is an antigen test. Antigen tests are also called rapid tests because the result is ready in 15 to 30 minutes. The CDC recommends nursing homes use antigen tests for residents so that results can be ready and action taken very quickly. It is very important that the COVID-19 test is given properly. If the test is not done right, it could give an incorrect result, and that could lead to an infected resident spreading the virus to others. Let's look at how you can help a resident prepare for an antigen test. Explain how the test will work before it begins. You can also explain what will happen before each step and offer comfort during the test. First, the nurse will insert a swab into the resident's nose. The resident may need help getting into position and supporting their neck for this part. You can explain that this part should not hurt, but it may be uncomfortable. The nurse will rotate the swab to collect mucus. Then the nurse will test the specimen based on the test manufacturer directions. Explain to the resident what will happen if the test is positive or negative. Ask the resident if they have any questions. Now, let's see what Aaliyah does when she suspects 2 of her residents might be sick. Aaliyah is a nursing assistant checking in with each of her residents when she discovers Mr. Miller has developed a bad cough and Mrs. Snyder is having trouble taking deep breaths. Aaliyah immediately informs her supervisor that 2 of her residents are sick, then dons, or puts on, full PPE in order to help the nurse perform an antigen test on both Mr. Miller and Mrs. Snyder in their rooms. Mr. Miller has dementia and may become upset during the testing. Aaliyah sits beside Mr. Miller and talks to him in a calm voice while the nurse performs the test. She explains what is happening during each step and keeps tissues close by in case the test makes Mr. Miller sneeze. After Mr. Miller's test, Aaliyah throws away her gloves, washes her hands, and dons new PPE before helping with Mrs. Snyder's test. Mr. Miller's test is negative, but Mrs. Snyder has tested positive for COVID-19. Mrs. Snyder is moved to a COVID-19 care unit while Aaliyah and her supervisor follow their nursing home's guidelines for testing the other residents and alerting family, staff, and the state health department of Mrs. Snyder's COVID-19 positive test. Although she is up to date on vaccination, Aaliyah is tested for COVID-19 a few days later to make sure she is not going to pass the virus on to the other residents in her care. Thankfully, Aaliyah's test is negative, so she can continue to do what she loves, caring for her residents. Now let's review a few key points. Think about the best answer for each of the following questions. What are some ways you can help comfort a resident during a COVID-19 test? Sit beside the resident, talk to them in a calm voice, explain what is happening, and offer them a tissue. What are the 3 main steps to conduct a COVID-19 antigen test? A swab is inserted into the nose, the swab is rotated to collect mucus, then the specimen is tested. Knowing your facility's guidelines on COVID-19 testing is an important step in protecting yourself and your residents. When you can recognize the symptoms and test quickly, accurately, and safely, you are also giving the best care possible to your residents. Being up to date with vaccinations and getting tested yourself are also important to keeping residents safe. You have completed this learning module. We hope you have learned about how recognizing COVID-19 symptoms and administering antigen tests quickly can protect you, other staff, and residents. Learn more. Watch the next video in this series to learn about why COVID-19 vaccinations are important. And visit the Agency for Healthcare Research and Quality's website for free tools to help you identify and treat COVID-19.